All right, so I'm going to try to switch to the next section here and move on to, you know, we've covered a lot of the diagnosis and the basics, to talking about, you know, the goals of therapy and escalation strategy. One of the things we have been talking about are non-medical ways of doing this. So we've touched on pulmonary rehab, exercise programs, vaccinations, and so on. But now let's kind of, you know, get towards some of the medical therapies. So when you're treating a patient, what is your goal of therapy and how do you escalate that strategy?
So I think the goals of therapy need to be targeted at what is bothering that person in front of you at that time, and they have to be customized. It's not one treatment fits all. We're hoping we can make even more progress with personalized medicine, but we even now have different approaches that ought to be uniquely applied to an individual. So if somebody has a lot of flare-ups and that's their major problems, and flare-ups are 2/3 of the costs of healthcare in COPD patients, so they're really important. Not only do the individuals struggle with it, does it affect their quality of life, but it burdens the healthcare system and the providers. That's one thing. The other is symptoms: shortness of breath with exertion, disability, withdrawal from activity, cough, sputum production. And with that, I have a line that I often ask my patients that gives me some guidance, because everybody starts at a different level. And I ask, what is the last thing that you lost? And we're going to target to try and get that back. Because in some cases, it's I can't leave the house anymore to go shopping in the more extreme states. In others, it's I can't do 18 holes without a cart anymore, and they're still golfing. And so you have to target the individual, what is their limitation, and then it also gives you as a practitioner a sense of whether your treatment is effective.
Let me just re-stress, because I think what Frank just said is really unbelievably important. Far too much in the respiratory world, and I do think in medicine in general, we as providers try to set goals. We need to do a much better job listening to the individual patient and finding out what goals are important to them. Whether they're the ones that Frank talked about, or being able to dance at your daughter's wedding, or be able to play ball with your grandchildren in the backyard. We need to define what the goals of that individual person are, and then we need to work with them to try to attain those goals. That's what our job is, and it sort of has gotten lost somewhere in the mix.